I'm Eva Gomez and reside in Macomb County, and this is my why I recommend Henry Ford Hospice to friends and family.
My name is Cody Murphy. I live in Macomb County, and this is my why I recommend Henry Ford Hospice to friends and family.
Hi, I'm Michelle Ford, and this is my why I recommend Henry Ford Hospice.
Peace be upon you. My name is Syed Hussain. I am the director of Henry Ford Hospice.
And my name is Dr. Anthony Grech, and I'm the medical director of Henry Ford Hospice.
For over 30 years, Henry Ford Hospice has been providing trusted hospice care that promotes dignity and affirms life. Our team is dedicated to providing the professional, comprehensive, and compassionate end-of-life care that every family not only needs, but deserves. Hospice provides pain management, symptom control, and comfort care when there is no likelihood of recovery from an illness.
At Henry Ford Hospice, our focus is on helping patients living every day the best way possible. Our physicians and nurse practitioners are all board certified in hospice and palliative medicine. We oversee our patients' care, working closely with and guiding the interdisciplinary team to meet our patient needs.
Our team also consists of registered nurses, home health aides, chaplains, social workers, dietitians, volunteers, and bereavement specialists. Our team is available 24 hours a day, 7 days a week.
My amazing wife, Sarah, was in hospice care within the comfort of our home. Our initial thoughts on Sarah being referred to hospice care was very scary, only because we knew that she had reached the end of her treatment options. With little knowledge of how hospice worked, very quickly where our minds changed, Jennifer, her nurse, instantly became like family, wholeheartedly.
I didn't like the word hospice. In my mind, hospice was a horrible place, but boy was I wrong. After meeting with the hospice team at Henry Ford Hospital, I realized that it was the best place for my husband, Nelson.
One of the aspects I like most about Henry Ford Hospice is the opportunity to perform home visits with our patients and their families. There is nothing like meeting with a patient and their family in their own environment and gaining a real sense for their day-to-day lives and the things that are most important to them.
Having a service such as hospice makes all the difference for your loved ones, as well as for a family. Losing someone is never easy, but these services made coping with the matter uncomplicated and manageable.
To help provide and support the patients with children in the family, Henry Ford Hospice developed SandCastles Grief Support Program. SandCastles have been providing grieving children, teens, and families a safe place to come together with peers to share and process their grief with others who understand. Supportive services have no fees, and we work hard to raise our donations to continue to provide the excellent level of bereavement care for which we are known for. Together, Henry Ford Hospice supports our patients, their families, through life's most challenging times to provide peace, comfort, and a safe space surrounded by people who care.
If Sarah needed a medication changed, refilled, or even just a good heart-to-heart talk with a fellow female, Jennifer was at Sarah's disposal. On top of our home health aide, even the after-hours staff was exponential, all the way down to sending a nurse out in the middle of the night, which we had to use on several occasions. With such a heavy and daunting realization that one is nearing the end of their life, Henry Ford Hospice helped Sarah and our whole family with the transition, making her feel at ease and that she was never alone in her journey.
From the initial discussion, Nurse Virginia was very understanding and thorough with explaining hospice to me. What I'm most appreciative of is that when she was providing me the information, I broke down because it's difficult talking about hospice when your mom is the subject of the conversation. Nurse Virginia allowed me the time to cry. She didn't try to rush the sharing. She was just present. Even during the intake, another nurse entered the office along with the minister, and they all showed nothing but kindness towards me. The entire hospice team treated my mom like the lady she was, and I will never forget that.